Okay, we're going to do the meta-analysis. We follow up the lecture on searching for evidence meta-analysis. The example we used was medication used for prevention of stroke and heart attack. It's a Plavix. And we went over the first study. This is the second meta-analysis we're going to review. This was published 2021. Let's go over, we talked about the CYP to C19, if you recall the first review. The reason we are continue on with the second meta-analysis it's because the population was Asian, Japanese, and a Korean population. That's number one. Number two is there was 5 clinical trials reported on Cochrane library, and we did the first review. Was from when this the author was involved in one of the clinical trial, and then the meta-analysis. And here it's risk of a major adverse cardiovascular event for concomitant use of clopidogrel and proton pump inhibitor in patient inherited CYP2C19 loss of function analysis. It's a meta-analysis. The reason we really don't, we're not focused on proton pump inhibitors here, but rather we want to see the review of the literature here, meta-analysis, how loss of function related to MACE. To answer our PICO questions, this is just a continuation of that. So although this one is have a shoot off analysis on proton pump inhibitors, but that's we're not going to focus on that. As I said, the highest evidence is systemic review and meta-analysis. The authors here is from a Department of Pharmacy, University of Rajshahi in Bangladesh. And as I said, it's published in 2021. And background here is the efficacy of clopidogrel. Let's see if I have that good. I want to make sure I have okay. Clopidogrel may be diminished due to either co-administration of proton pump inhibitors or carrying CYP2C19 loss of function analysis. However, patient may be at great risk of major adverse cardiovascular event if taking clopidogrel together with the proton pump inhibitors, and also inherited the CYP2C19 loss of function analysis, which may cause further reduction of clopidogrel efficacy. This is due to the cumulative effect of the drug-drug interaction and drug-gene interaction, collectively referred to as multifactorial drug-gene interaction. So the aim of that this analysis was to estimate aggregate risk of major adverse cardiovascular event for either coronary heart disease or stroke patient with a multifactorial drug-gene interaction versus a clopidogrel alone with or without drug-gene interaction. What is the method they used here? That's the focus of our class. Its literature was searched using different resources based on the preferred reporting items for systemic reviews and meta-analysis. This is what we call it, Prisma, right? Guideline. Meta-analysis was performed using RevMan software following either fixed or random effect model based on the level of heterogeneity. If you recall, we talked about that one during our last lecture. A p-value less than 0.005 two-sided was considered statistically significant. Result. In total, 5 studies consisting 8,802 patients of coronary artery disease or stroke were included in this meta-analysis, in which 3,767 were prescribed clopidogrel alone. 1931 were committed to taking clopidogrel and the PPI, proton pump inhibitor, PPI. 2146 were carrying CYP2C19 loss of function, ALAS, and 958 were taking both clopidogrel and proton pump inhibitor, while also carrying CYP2C19 loss of function, ALAS. It was found that a patient with a multifactorial drug gene interactions were associated with significant increased risk of MACE compared to those taking clopidogrel alone. That's one arm of the research study without the CYP2C19 loss of function ALAS. Patients with the multifactorial drug gene interactions were also associated with a significant increased risk of MACE compared to drug gene interaction. So here is the reported odds ratio is 1.63. We're going to go into that. Patients taking clopidogrel with the proton pump inhibitors were also associated with 35% significantly increased risk of major adverse cardiovascular comparing with those taking only clopidogrel. Conclusion, patient inherited CYP2C19 also function and they have significant increase risk of MACE when taking clopidogrel and proton pump inhibitor concurrently. So I know this one is a little bit adding another layer to the meta-analysis, but I thought it's since we're on Plavix, and this is at the end, I'm going to post the question. What do you think after you read this article? Is that to change your mind about the consistency and the inconsistency related to our first study, which basically is those taking Plavix and they are either have loss of function in ALAS and with associated with the increase of MACE incidence. What could be look into that in the future? Should we, for example, since I'm on this topic, how many people actually taking PPI, and did we take that confounding factor out? Should we look back to the first research we just reviewed? How many patients actually on PPI? So this is how, as a scientist, you go back and forth to reevaluate your conclusion, right? So let's continue on. The keywords here is clopidogrel drug and the gene interactions, because they do have the interaction is then the interaction with proton pump inhibitor, and this MACE is one of the outcome, right? And the impact on practice here is patient with a CYP2C 19 loss of function analysis taking clopidogrel and PPI concurrently were associated with 73% significantly increased risk of MACE to those who just taking clopidogrel alone without patient concurrently taking both also inherited CYP2C19 loss of function were associated with a 63% increased risk of MACE compared to those taking clopidogrel with CYP2C19 loss of function analysis. Okay, let's take a look at this study. The flow chart here is the Prisma guidelines, how you select the literature. So different database search and records identified 354 and removed the duplicate of 102. Now we have a 252. Exclude after title and the abstract. This is usually is the big chunk of it to remove. And the full text article reviewed for the primary eligibility is 15. They excluded some studies not relevant to answering the PICO question, and you come up with a 5. Then exclude the full text due to not reporting clear outcome data on both arms, then you come to remove 1, and you end up with a 5 researchers. Okay, and because our focus is more over CYP2C19 loss of function analysis, and although this has added a component with the PPI, but it's still a good meta-analysis look into that. Let's take a look of the first, the figure 2 here. So basically, it's clopidogrel using alone and clopidogrel PPI and with loss of function. That's allowed to combine them together. And take a look of forest plots here. And you can see only 1 or 2 studies actually not significant, not 2 or 3 of them. No, actually 3 of them, not only 2 of them are significantly associated with this one. And to answer the question, but the heterogeneity is not so great. So it's very questionable, but this is what they concluded here is they have increased risk in this group by 1.73% because the diamond never touched the line of effect, right? And it's on the right side. Therefore, this side have high risk. All right. So Forrest, basically the first one said here that those who take clopidogrel alone, and those who take clopidogrel PPI and has loss of function have increased risk. Let's take a look at the second one. Sorry. Figure 3. Figure 3 basically Forrest plot of the aggregated risk of a MACE for the patient carrying CYP2C19 loss of function analysis taking clopidogrel with the PPI versus clopidogrel with the CPY2C19 loss of function analysis. So you here have you almost can answer some of our question here. Is we are looking into those who has loss of function, and if you want to cross-reference to other study, you can do another meta-analysis. But let's take a look of this one. Here, the first study, 731 patients have the taking the medicine with Plavix with loss of function analysis, and this one have loss of function analysis, loss of PPI, and 3 of them again there's no difference, and 2 of them this one is still very close to the line of effect. Let's just say these 2 support what they concluded. Those who take who has loss of function analysis, if you take it alone and take it together, there's a 1.63 increase of risk for MACE. Here, basically, you can, if you're looking into these researchers, the research, you're thinking, gee, I wonder how much is PPI or how much is the genes, right? Because the PPI itself will serve as a the CYP2C19 gene inhibitor. So it's added effect, right? So that's the second. The next one, let's take a look at how they divided it into the group. So this is Plavix, PPI, CYP2C loss of function. Plavix, PPI, not loss of function. And you can see that really this is not significant. So basically say that you have a loss of function, you have a PPI, you have a Plavix, comparing with those who has no CYP2C19 loss of function. There's no statistically significance. This will make you wonder how much is the PPI, how much is really the gene. Let's take a look of the population because it's Bangladesh. But again, regardless, those who has a CYP2C19 gene, loss of function should still demonstrated in those studies, right? So that's give you some clue. You need to look into that, how much gene has effect. But this one, the author actually reported that the gene, maybe the sample size is too small. That's what they concluded. Said that the CYP2C19 loss of function analysis was not significant in the study. And this more of separate them. One is clopidogrel with PPIs versus clopidogrel by itself. Again, you see here is significant. So, so the PPI seems like working more against Plavix effect. Gene did not have that effect, right? Let's take a look at the second group. This group, they have clopidogrel with CYP2C19 loss of function and without loss of function. Again, you see all cross line of effect. So it's not significant. And it's pretty valid because this basically the heterogeneity is 27%. The next one they separate them is clopidogrel PPI versus clopidogrel, and loss of function. They want to see how much PPI have anything to do if they have a loss of function group and the normal group. So what they found out is not this again. This is great heterogeneity. It basically said that PPI group, there's no difference from these CYP2C19 loss of function. So let's take a look of how they inform the practice based on this analysis. And they found that only the PPI carrying of clopidogrel with the PPI carrying CYP2C19 loss of function analysis compared to those who use clopidogrel alone, with or without, they have an increased risk, right? So they refer, if you want to do, they don't really recommend any gene testing. They just say they need more studies in the future to look into the CYP2C19 and the clopidogrel MACE. So that's the second literature review, meta-analysis. I hope this reinforces you on some of the knowledge we already have on how to search the evidence. Meantime, make you wonder about, even it's a meta-analysis, should you question the results, especially when the results are controversial, right? And here give you some of related to the study. In patient out of 5 studies, patient in 3 studies, Simon et al., Goodman, Deepta used the omeprazole. I want to see if they tell you the population. They actually, okay, this one is like a Japanese population. I was really looking for the population. Okay, so again, regardless the population, they compared those who has CYP2C19 loss of function analysis. I hope this give you some extra, extra lens to view research. And if you have any questions, we can